again, joining us today, I started last week on my right. Today I'm going to start on my left. I'm going to ask Dr. Richardson if you just introduce yourself again and just let us know. We'll just do introductions now and say hi to everybody. Tell us where you serve and what you do. I don't think we did that Sunday, what you're doing and where you're serving, if you would, and then we'll come back and we'll just get into the questions.
Well, Peace Baptist Church, and thanks, Reverend Burnett. Hey, it's great to be here, especially with my colleagues. Eddie Richardson, Jr., I'm from Putnam General, which is a town about an hour and a half east of here. I'm actually a hospitalist. I'm a geriatrician, family physician, and a hospitalist, which means I take care of patients on the inpatient services and have been inundated in this COVID since last year, probably taking care of more than 200 cases throughout the last year or so. And I also have my own practice, which is Lake Oconee Urgent and Specialty Care Center, as well as Lake Oconee Concierge Medicine, where I do ambulatory care. I've been taking care of patients as an outpatient as well, and been a long-time member of Peace.
Amen. Praise God. Thank you so much. There's not a lot of research out there, but you all feel comfortable with where we are today. That's good. I think that's really excellent. Eddie, let me ask you a question. What things did you see here that you wanted to bring up? Is there something that?
Sure. Thanks, Reverend. Just to sort of backtrack for just a little bit in reference to the question of earlier about research and the speed, or what we conceive as the speed of the vaccine coming on market, and the way it came on market, and you're hearing some new terms out there. You're hearing EUA, you're hearing, rush to market, and those are not terms you heard. But if you remember back, and I remember this particularly being a medical student at Morehouse when the HIV epidemic came about, and it was disproportionately affecting African Americans. And that was a time then when we only had AZT, that new medication started to come out, just as this vaccine has come out, to start to treat patients, because the alternative they were going to die. And so they started releasing those sort of EUA as well, and they slowed the eradication of HIV. So we've been in times like this before that we had it. It's just that COVID seems to be so prevalent and so much more emphasis is on it. And for our newer generation, sort of what Dr. Griffin said, our new generations hadn't had anything like this. They haven't been through anything like this. So it just seems new to them. So we've been there, but this is, being a physician and seeing the devastation of it. We have to get the medications out there. We have to do what we can to slow it down. And sort of to what Dr. Lee said, there's money poured into that. And we can make magic happen. It just takes the right mind. We're brilliant folk when it takes that. So I just wanted to piggyback on what they were saying in reference to that. One of the things I saw that I wanted to go ahead and bring out was I saw a question on here about vaccination and herd immunity. And so for all of us that have a little bit, let me back up just a little bit. For all of us that have hesitations about the virus, what they're actually saying is we've got to have 55 to 80% of the population across the United States vaccinated. And Georgia right now, as of 2 days ago, only had 1.2% of its population vaccinated. 1.2 million people have only been vaccinated in the state of Georgia. That's frontline workers. So we got a lot of work to do. So if we want to get back to some sort of a life and move past this, we got a lot more vaccinations. And so we need the naysayers and the ones that really don't believe that the vaccinations are worthwhile and that they are the right approach. If we want to get back to life, we really got to get folks vaccinated. And yeah, as we've said, both here, our three colleagues, my colleagues have said, the vaccine is one of the best ones we brought out, especially in recent times.
So specifically, there are questions around infertility and the vaccine, and this is probably coming from some conspiracy theories. There's nothing in the scientific literature to signal that women have an increased risk of infertility. As a result, there are women right now who are trying to get pregnant and getting the vaccine, and there's no signals there. Obviously, these women are not necessarily in clinical trials, so I can't give you data, but we certainly haven't seen any negative effects. And what I want to emphasize more than anything is think about the risk of getting COVID versus the risk of getting the vaccine. Nothing is risk-free, but think about what can happen. If you're not alive, you can't get pregnant. And unfortunately, COVID can take some of us out. Luckily, it doesn't take everybody out, but it can take some people, and there's no way of predicting whether or not you'll be that person. The other thing we're starting to learn about COVID as people recover from it is that there may be some long-term effects that we have no idea what those are. And I would not want to gamble with my fertility and have COVID because I don't know what that virus could do. So again, I'm looking at, no, we don't have that information, but I'm looking at what's that risk, and, you know, what am I willing to accept?
Dr. Lee, you are so correct. Some of the long-term consequences that I'm seeing at this stage is lung scarring, permanent lung. People are becoming having restrictive lung disease after this, cardiovascular, becoming cardiovascular risk, and having almost like sudden death syndromes where it scars the tissue in the heart. So you're right. There's going to be studies, and I keep saying to patients, we're going to see years from now what some of these consequences are from this disease. I know I had a friend, young surgeon brother of mine, early 40s, had COVID, and ended up, after he recovered about 2 weeks later, ended up having an arrhythmia and fell. And not only did he get COVID, but he fractured his face on both sides, his temporal bones, and was out another 6 weeks recovering from this. And when they did a CT scan of his chest, they showed where he had scarring, like someone who had smoked or who had sarcoidosis for multiple years. And also the tissue was damaged. So, you know, that's going to be a cost to the healthcare system. It's also going to be a cost to our body as well. Wow. One question is about where do you go and find out about where you can get a vaccine at. If you go to the DPH website, you can actually look it up, put in your county, and it will actually tell you where some of the sites are. I'll tell you as being, I think there's 2,100 providers. Supposedly starting tomorrow, they're going to start shipping directly to pharmacies. And so one of the things I did look up and what I found is that we got 940-something thousand vaccinations of the Moderna, which have all been given out as of 2 days ago, okay? We got about 650,000 shots of the Pfizer, and I think there's like 2,000 still out there somewhere that are being given out. And so we're waiting on the next shipment. I'm waiting on my next shipment to come in from my office. There's lists. Get on the list. Some of the areas have 2,000-3,000 people waiting. I'm talking in the smaller counties outside of Atlanta. But if you go to the DPH, it sort of directs you into your regional where you can actually go to get the shot at. So I would suggest you get there. Tuesday morning, I think around 7 a.m. is when the site opens back up. So that's one place you can start to find out where it's going to be at. And then you just kind of watch to see where DPH is at. Who should be taking the vaccine? Right now, we're in the 1A plus, and which is still the healthcare and the frontline workers. And care providers. The list is a little bit longer, but you can actually look that up. And then we're going into the 1A, which is still frontline workers and firemen and in that area. So those should be taking it. I think one of the good questions I also saw, if you've had COVID, should you take the vaccine? Yes, you should, but 90 days. You can wait up to 90 days. And the reason that is, I believe, don't quote me, but I believe it's because they think you have some sort of immunity in between up until that period of the 90 days. And then you should get the actual vaccine. And so it helps you to be there. If you've had any kind of vaccination, the other thing you need to be concerned about is if you've taken any other vaccination, 14 days before or either 14 days after. So if you've had another vaccination, you need to wait 14 days before you take.
Like the flu or shingles or
yes.
any of those? Okay.
Yes, you need to wait at least 14 days.
When you get the first dose, do they put the second dose in reserve for you?
They don't necessarily put it in reserve, but they do have it for you, and they're saying what they are suggesting you do from DPH is that you register for the second dose. So they have you. And they actually have some technology where they will start to text you when you're getting close. I was reading, doing some research. You could go as far out as 6 weeks to get the second dose. And then I think one of the questions to clarify, on that is if you get a Pfizer first dose, take a Pfizer second dose. If you get a Moderna first dose, take a Moderna second dose. Don't
Can't
mix
mix
the two doses. And the Pfizer is 21 days between doses, and the Moderna is 28 days or a month. And you can go out. I saw you could go out to as far as 6 weeks, but they're not reserving. But they are saying if you're on the books for that second dose, you should be able to get that second dose. And that was one of the things in Georgia. It's been running pretty good. The numbers are you've had, and something I was like, how does that make sense? Nationwide, there's been 39 million vaccinations given out, and 30 million were the first, and then the other 9 million were the second doses. So they've got them out there kind of waiting, and they're getting their shipment in. So, yeah.
1,000 IUs of D and the 60 of zinc and the 1,000 of who have underlying conditions like heart issues or diabetes. Is there any danger in taking more of those vitamins for anybody? Would you all?
To answer that, I have not seen that because, most of the time if you're taking a multivitamin, which I recommend to all of my patients, a multivitamin, you have some level of zinc, you have some level of the vitamin C already there, and it doesn't interfere. You're taking at a little bit higher dosage, so I really haven't seen any side effects from that at this point. Have you? Have your colleagues have it?
That's excellent. Okay. Good.
And many African Americans are already vitamin D deficient because we don't get as much sun. So taking a little extra is probably
not a bad thing.
Not a bad thing.
The CDC website will address a lot of that. And in the short time that we have, we're not going to be able to address every issue and every concern, but we are here to help you. And we want to do whatever we can. But there may be something that you all want to add or to say.
I just want to reiterate that, we've gone through a year, right? Yeah. Even if there wasn't COVID, 2020 was going to be a year. But having gone through all of that, it's completely understandable to have fears about this. When there's information overload like there is, everybody's getting fly-by-night now, physiology and biochemistry training that we took 2 years in medical school to learn, and everybody's trying to adapt to antigen versus antibody testing and all of that. It's overwhelming, and we completely understand that. But I think at some point you have to put some faith in your brothers and sisters, and that's what we are, that we all have a role to play, and our role was to look through this information, critique it, audit it, like you said in the sermon on Sunday, and make sure that it's the right thing for us, and I think it is.
It makes sense to be afraid. It's all very new. COVID is new. This has never been something that most of us in our lifetime have had to deal with. But this is a time for miracles. I really believe that, and I think that this is just one of them. There'll be others that we'll see that might not even necessarily be science, but we'll see some other things happening in our nation, in our country, and I just think that, we need to be open, we need to be prayerful, but we also, need to educate ourselves about, how do we get past this? How do we move past this?
Again, I echo exactly what they said. But, on a real live wave, I would say dealing with this and having actually had so many patients pass, it gets real heavy. So I would say in reference to the vaccine versus not vaccine is that I know what COVID will do to you. I've seen the devastation of what it does. And people are losing family members. 1 in 17 has been infected by COVID. So, a side effect, and I think Dr. Griffin may have said this, a side effect, a little fever, a little chill versus death is a pretty high price to pay. So when you're sitting there saying, I'm not going to take the vaccine because I'm concerned that it's not going to work, you've heard from us, again, your brothers and sisters, your fellow members at Peace, say we are scientists, we believe the science, and we have confidence in the science. But we're also saying the warning is that if you don't do something like this, you have a risk of dying. And is it worth that? And that's a choice you really got to make and think about it. And, Rev tells us to be vigilant and to be prayerful and to use what God's given us. And so we have to do that and be prayerful about it and let him lead us in the right direction. So I certainly appreciate this platform for us to inform our members and inform the community at large of what next steps are to be. So I'm just grateful and thank you.